Welcome to your Health Facts podcast. Today we're diving deep into those subtle signs your liver might be sending you. You've been feeling a bit off lately, maybe more tired than usual.
The liver is a remarkable organ, responsible for over 500 vital functions.
Exactly. And those signals can be surprisingly subtle. So if you've done your research and you're wondering if your liver could be the culprit, well, you're in the right place.
From filtering toxins to producing essential proteins, the liver plays a crucial role in maintaining our overall health. Unfortunately, the early signs of liver damage can be incredibly subtle, making it challenging to detect a problem until it has progressed significantly.
We're going to uncover 7 early signs of liver damage that you might not even connect to your liver.
One of the most common early signs is discomfort or tightness under your right rib cage. When compromised, the liver can swell and press on surrounding structures, including nerves that extend to the shoulder and arm.
So that nagging pain in your shoulder, the one you've been blaming on your desk job, might actually be your liver talking.
Another common early warning sign is a persistent lack of energy and diminished endurance.
You know that feeling when you just can't seem to shake off the tiredness? That could be your liver trying to tell you something.
The liver is intimately involved in energy production, converting food into usable energy for the body. When its function is impaired, you might experience a noticeable decline in your energy levels, impacting your stamina and overall vitality.
Interesting. What about itchy skin? I've heard that can be related to the liver too.
Absolutely. Itchy skin, a seemingly unrelated symptom, can also be a red flag for liver issues. Imagine your liver like a drain. When it's clogged, the dirty water backs up and irritates your skin. This often occurs when the liver isn't processing bile effectively. Bile salts, essential for fat digestion, can build up in the bloodstream and tissues, leading to intense itching, particularly in the extremities.
Those tiny red dots or spider veins, medically known as spider angiomas, are another subtle sign that often gets overlooked.
These are frequently linked to hormonal imbalances, specifically elevated estrogen levels. The liver plays a critical role in hormone regulation, and when it's struggling, estrogen can accumulate, manifesting as these characteristic skin changes. Speaking of hormones, this brings us to another often overlooked sign. A sluggish thyroid could be a consequence of an underlying liver issue. The liver is vital for thyroid hormone activation, and a compromised liver can exacerbate existing thyroid problems, further contributing to a range of symptoms.
You also mentioned vitamin D being affected by liver function. I've heard there's a connection, but I'm curious to learn more about the specifics.
It turns out the link is much stronger than most people realize. The liver is crucial for processing and utilizing vitamin D. Even if you're diligent about sun exposure or taking supplements, a compromised liver might hinder your ability to maintain healthy vitamin D levels. Vitamin D is vital for bone health, immune function, and even mood regulation, so a deficiency can have far-reaching consequences.
And finally, we have changes in urine as a potential indicator of liver distress. Have you ever noticed that the color of your urine can change depending on how hydrated you are? Well, if you've consistently noticed darker urine or an unusual odor, it could be a sign that your liver isn't filtering waste products effectively.
This warrants attention as it suggests a potential disruption in the liver's detoxification processes. While these 7 signs are common indicators of potential liver distress, there are other subtle cues your body might send. It's crucial to pay attention to these seemingly minor symptoms, as they could be our body's way of signaling an underlying issue. One such sign is a change in bowel movements. If you experience persistent constipation or diarrhea, it could be related to impaired liver function.
So think about your own habits. Do you find yourself reaching for over-the-counter laxatives or struggling with digestive discomfort more often than you used to?
This might be your liver trying to get your attention. The liver produces bile, which is essential for fat digestion and absorption. When bile production is disrupted, it can lead to digestive irregularities. Another surprising sign is an increased sensitivity to medications or supplements.
So essentially, our tolerance levels might change, indicating the liver isn't functioning optimally. This is incredibly insightful. I hadn't realized the connection was so strong.
The liver plays a crucial role in metabolizing and detoxifying substances we ingest. If its function is compromised, even common medications or supplements can build up in the system, leading to adverse reactions. It's a subtle yet significant sign that shouldn't be ignored.
Unexplained weight loss is another red flag that often raises concerns. While weight loss can be a positive outcome in certain situations, unexplained or unintentional weight loss can sometimes be a sign of underlying liver disease.
This highlights the importance of seeking medical advice when experiencing such changes. Absolutely. It's always best to err on the side of caution and consult with a healthcare professional to rule out any serious conditions. Speaking of medical advice, regular checkups, including blood tests, can be incredibly valuable in identifying early signs of liver dysfunction.
So even if we don't experience any noticeable symptoms, routine blood work can provide crucial insights into our liver health. It's a proactive step towards safeguarding your liver and overall well-being. Now that we've covered the various signs of potential liver damage, let's shift our focus to understanding the underlying causes.
Liver damage can stem from a variety of factors, including viral infections, alcohol abuse, certain medications, and metabolic disorders. It's important to note that not everyone who consumes alcohol or takes certain medications will develop liver problems. Individual susceptibility varies greatly, and factors like genetics, lifestyle choices, and overall health play a significant role.
One common cause of liver damage is non-alcoholic fatty liver disease, or NAFLD. This is becoming increasingly prevalent, particularly in individuals with obesity, insulin resistance, or type 2 diabetes. Have you ever considered the impact of your diet on your liver health?
You might be surprised to learn that even without excessive alcohol consumption, the accumulation of fat in the liver can lead to serious problems. NAFLD is a condition characterized by the accumulation of fat in the liver, even in individuals who consume little or no alcohol. Lifestyle modifications such as weight loss, regular exercise, and a balanced diet are crucial for managing AFLD. Another major cause of liver damage is viral hepatitis.
Hepatitis is an inflammation of the liver, often caused by a viral infection. There are different types of hepatitis, including hepatitis A, B, and C. These viruses can be spread through contaminated food or water, blood transfusions, or sexual contact.
It's crucial to be aware of the risks and take preventive measures to protect ourselves from these viruses. Vaccination is available for hepatitis A and B, and effective treatments exist for chronic hepatitis C infection.
Absolutely. Awareness, prevention, and early detection are key to minimizing the impact of viral hepatitis on liver health. Moving on to the topic of alcohol consumption, it's well established that excessive alcohol intake can damage the liver.
Long-term heavy alcohol use can lead to alcoholic fatty liver disease, alcoholic hepatitis, and ultimately cirrhosis. Cirrhosis is a serious condition characterized by scarring of the liver, which impairs its function.
It's important to emphasize that moderate alcohol consumption is generally considered safe for most adults. However, individuals with pre-existing liver conditions or other health concerns should consult with their doctor regarding alcohol intake. Personalized guidance is essential to ensure alcohol consumption aligns with individual health needs. Certain medications and supplements can also contribute to liver damage.
Over-the-counter pain relievers, like acetaminophen, can be toxic to the liver when taken in excessive amounts or for prolonged periods. It's crucial to follow dosage recommendations and avoid mixing medications without consulting a healthcare professional. Herbal supplements, while often perceived as natural, can also pose risks to liver health.
It's essential to research and choose supplements wisely and inform your doctor about any supplements you're taking. Transparency with your healthcare provider ensures they can monitor for potential interactions or adverse effects. In addition to lifestyle factors and external influences, genetic predisposition also plays a role in liver health.
Certain genetic disorders can increase the risk of liver disease, including hemochromatosis, Wilson's disease, and alpha-1 antitrypsin deficiency. Early detection through genetic testing can be beneficial in managing these conditions and preventing complications.
It allows for proactive interventions, such as lifestyle modifications, medications, or regular monitoring, to mitigate potential risks. Now that we have a better understanding of the causes of liver damage, let's explore the importance of early detection.
As we discussed earlier, the liver often doesn't exhibit noticeable symptoms in the initial stages of damage. That's why regular checkups and blood tests are vital for identifying potential issues before they escalate. Early detection of liver damage is crucial for preventing further deterioration and improving treatment outcomes.
What specific blood tests are used to assess liver function?
Liver function tests, or LFTs, measure the levels of certain enzymes and proteins in the blood that reflect liver health. Elevated levels of these markers can indicate liver damage or inflammation.
Some commonly measured markers include AST, ALT, ALP, bilirubin, and albumin. These tests provide valuable insights into the liver's ability to perform its vital functions. In addition to blood tests, imaging studies such as ultrasound, CT scans, or MRI may be recommended to assess the liver structure and identify any abnormalities.
These imaging techniques allow healthcare professionals to visualize the liver and detect any signs of fatty deposits, inflammation, or scarring.
Early detection allows for timely interventions, whether it's lifestyle modifications, medications, or in some cases, surgical procedures. By addressing liver issues in their early stages, we can significantly improve the chances of preserving liver function and preventing serious complications. Prevention is always better than cure, and early detection is a cornerstone of effective liver care. Now let's delve into the fascinating world of liver regeneration, a remarkable ability of this vital organ.
The liver possesses an incredible capacity to regenerate itself, even after significant damage. This regenerative ability is truly remarkable and sets the liver apart from many other organs. When the liver is injured, it can repair and replace damaged tissue, restoring its function to a significant extent.
It's almost like superpower.
Even after significant damage, your liver can, in many cases, rebuild itself, almost like a phoenix rising from the ashes. This incredible regenerative ability involves complex cellular mechanisms that are still being studied and understood.
However, it's important to note that the liver's regenerative capacity has its limits.
Repeated or chronic damage can overwhelm the liver's ability to repair itself, leading to permanent scarring and dysfunction. That's why it's essential to protect our liver from ongoing insults and seek medical attention if we suspect any issues. Let's now explore some practical tips for maintaining a healthy liver.
Maintaining a healthy lifestyle is paramount for liver health. This includes consuming a balanced diet rich in fruits, vegetables, whole grains, and lean proteins.
Limiting processed foods, sugary drinks, saturated fats, and excessive salt intake is also crucial.
Regular exercise plays a vital role in overall health, including liver function. Aim for at least 150 minutes of moderate intensity aerobic activity or 75 minutes of vigorous intensity aerobic activity per week.
Maintaining a healthy weight is also essential for liver health. Obesity increases the risk of developing fatty liver disease and other liver-related complications. If you are overweight or obese, even a small amount of weight loss can have significant benefits for your liver. Limiting alcohol consumption is crucial for preserving liver health.
If you choose to drink alcohol, do so in moderation, following the recommended guidelines for men and women.
Avoiding smoking is another important step towards a healthy liver. Smoking not only damages the lungs, but also increases the risk of various cancers, including liver cancer.
Being mindful of medication use is essential. Always follow dosage instructions and consult with your doctor before taking any new medications or supplements.
Be cautious with over-the-counter pain relievers, as excessive use can harm the liver. It's also wise to inform your doctor about any herbal supplements or alternative therapies you're using.
Vaccination against hepatitis A and B is highly recommended.
These vaccines can significantly reduce your risk of contracting these viral infections, which can lead to liver damage.
Practicing safe sex is crucial for preventing hepatitis B and C transmission. Use condoms consistently and get tested regularly if you engage in high-risk behaviors.
Be cautious with tattoos and piercings. Ensure the establishment follows proper sterilization techniques to minimize the risk of blood-borne infections.
Maintaining good hygiene practices, such as washing your hands frequently, can also help prevent infections that can affect the liver.
It's a simple yet effective way to reduce the spread of germs and protect your overall health. Regular medical checkups and blood tests are crucial for monitoring liver health. Even if you don't experience any symptoms, routine screenings can detect early signs of liver damage.
Early detection allows for timely interventions and can significantly improve outcomes. Remember, a healthy liver is essential for a healthy life. By adopting a healthy lifestyle and taking proactive measures, we can safeguard this vital organ and enjoy optimal well-being.
Now let's shift our focus to the fascinating realm of liver transplantation, a life-saving procedure for individuals with end-stage liver disease. Liver transplantation is a complex surgical procedure that involves replacing a diseased liver with a healthy liver from a donor.
It's a remarkable feat of modern medicine, offering hope and a second chance at life for those with failing livers. What is the criteria for liver transplantation?
Liver transplantation is typically reserved for individuals with end-stage liver disease, with other treatment options have been exhausted. This includes conditions such as cirrhosis, severe hepatitis, or liver cancer. Candidates for transplantation undergo a rigorous evaluation process to assess their overall health, suitability for surgery, and ability to manage the lifelong demands of post-transplant care.
There are two main types of liver transplants: deceased donor transplantation and living donor transplantation. In deceased donor transplantation, the liver comes from a deceased individual who has consented to organ donation. This is the most common type of liver transplant.
In living donor transplantation, a portion of the liver is donated by a living person, typically a relative or close friend. The liver has the remarkable ability to regenerate, and both the donor and recipient's livers will grow back to their normal size.
The success rates for liver transplantation have significantly improved over the years, thanks to advancements in surgical techniques, immunosuppressive medications, and post-transplant care. What are the long-term outcomes for liver transplant recipients?
Liver transplantation can dramatically improve quality of life and extend lifespan for individuals with end-stage liver disease. However, transplant recipients require lifelong immunosuppressive medications to prevent organ rejection. These medications come with potential side effects and require close monitoring.
Regular follow-up appointments with the transplant team are essential to manage medications, monitor for complications, and ensure optimal health outcomes.
Liver transplantation is a complex journey that requires a dedicated team of healthcare professionals and the unwavering support of loved ones. It's a testament to human ingenuity and the power of organ donation to transform lives. Now, let's explore some emerging trends and future directions in liver health research and treatment. The field of hepatology, the study of the liver, is constantly evolving with ongoing research and advancements in treatment options.
One exciting area of research is the development of new antiviral therapies for chronic hepatitis C infection. These therapies offer high cure rates and have revolutionized the treatment of hepatitis C.
Another promising avenue is the exploration of non-invasive diagnostic tools for liver disease. These tools aim to provide earlier and more accurate diagnoses without the need for invasive procedures. Researchers are also investigating novel therapies for non-alcoholic fatty liver disease, which is becoming increasingly prevalent worldwide.
These therapies target the underlying metabolic abnormalities associated with NAFLD and aim to prevent progression to more severe liver disease.
Gene therapy is another emerging field with potential implications for treating genetic liver disorders. By manipulating genes, scientists hope to correct genetic defects that contribute to liver disease.
Stem cell therapy is also being explored as a potential treatment for liver failure. Stem cells have the ability to differentiate into various cell types, including liver cells, offering hope for regenerating damaged liver tissue.
The future of liver health is filled with possibilities, and ongoing research holds the promise of even more effective treatments and preventive strategies.
As we conclude our deep dive into liver health, it's crucial to remember that knowledge is power. By understanding the importance of liver health, recognizing early warning signs, and adopting a proactive approach to prevention, we can empower ourselves to safeguard this vital organ. For more in-depth information and insights on liver health, be sure to visit yourhealthfacts.com. We hope you found this deep dive into liver health informative and empowering. Remember, a healthy liver is essential for a healthy life. Take charge of your liver health today.